Good morning, everybody. This is Marcus and Chad here at Amada in San Clemente, California. Hey, I want to thank everybody for joining us today. It was a good Thanksgiving, and this is kind of back to reality this week. So I hope you guys are all doing all right. And it does mean a lot to us that you would join us on this busy Wednesday. Some of you guys on the East Coast, you're on the tail end of the day. So thank you so much for doing that. We have Jenny on the line here today with us. And let me see here. I want to make sure that, let's see, Jenny, I see you on there. Now what you'll need to do is enter your audio code to be able to speak, I believe. Jenny, can you hear me? All right, so Jenny, if you can hear me, make sure that you enter your audio code so that we can unmute you here in just a little bit. Now, there's a few people that are still joining. Actually, our numbers are going up here by the minute. So here's what I'd like to do. So for some of you guys, this might be the very first time you have talked to us here at Amada. Maybe you've looked at us for a very long time through social media or somebody introduced you to our brand. So just before I introduce you to Jenny Novy, I wanted to tell you a little bit about what we do. We're Amada Senior Care, and this will be quick because really the call today is, the goal is to get you to ask your questions from Jenny, hear about her experience joining Amada. So let me go through this real quick. So first of all, we are a home care company, and what that, hang on here, there you go. And what that means is that we do home care, which means that we send caregivers to seniors' homes to take care of activities of daily living. That could be dressing, bathing, meal preparation, whatever it takes for the senior to be able to thrive in their home. So that's the home care side. Now what we also do is placements, where when we find a family that home care may not be the best fit, then we help them find an assisted living, a boarding care, an Alzheimer's care unit. Now, as you go through the process, you'll learn a lot more about us, but quick introduction about how we started. Chad and Tafa founded the company back in 2007. Chad is here with us today, and they went from just the two guys here in Orange County marketing their tails off, and they grew from 0 to about 350 caregivers, 14 administrators, 6 sales staff, and a revenue of $8.7 million by 2014. So we took this model and we helped other entrepreneurs throughout the country be able to do what Chad and Tafa did here in Orange County. Now, one of the differentiations about us, because there's a lot of home care companies out there, and as we bring Jenny on board, we'll be able to talk more about that, about our differentiation. But I want to let you know that we specialize in some very important niche products in home care. And this is a bigger conversation that we'll have as you go through the discovery process. But I want to let you know that Amada is very different from other home care companies out there. We specialize in helping veterans unlock their benefits. So they fought for our country, but a lot of times they have a hard time unlocking the benefits that they so deserve. We specialize in that and helping them achieve and get those benefits. We also work with workers' comp and long-term care insurance. These are two enormous payers in the United States, but they're very difficult to access for the families that have long-term care insurance, or the administration of workers' comp can be difficult for a lot of families. So we specialize in that. What that allows us to do is allows us to have a really in-depth conversation with our referral sources and with our families and really advocate for them. We don't just do what's going to make us money. We really focus first on what's best for the family. It doesn't matter how much money we're going to make. We want to make sure we advocate for that senior, that they get all of their options explored and decide whatever is best for them. And that's really how we differentiated ourselves ever since 2007. Chad, would you add anything to that differentiation strategy of how you guys built that here in Orange County?
You know, I think there's a couple different things. I think that the thing that differentiates us the most is just our ability to connect with our clients and be able to meet their needs, whether they are a veteran and they need help with their VA and attendance benefit, or they have long-term care insurance and they need someone to walk them through claiming on that policy for them. Maybe it's even just sitting down with them and understanding the difference between home health and home care or hospice, and understanding how to access these different benefits. I think the greatest thing that we've been able to do is build up an expertise of being able to really help families through a very difficult time and kind of walk them through that process and be their advocate, whether it's teaching them what they should be doing as far as care pathways go, or how to access different funding to pay for that care. So, I mean, that's kind of a really broad statement. We can get deeper, and I'm sure Jenny may talk a little bit about what she does in her market. But I think the fact that we do what's right for our patients first. You know, we're one of the few companies that does in-home care placement as well as remote in-home technology. What we found is that, you know, home care may not be the best thing for every single person out there. You know, assisted living may be the best fit, or memory care, or even having an in-home, you know, monitoring system put in place. Whatever their budget needs, their care needs, and their socialization needs are, we kind of do an assessment and find out what those three things are, and then we put together a care plan that's best for them. And then we have, you know, financial models that work for you as a business owner to be profitable as a business by doing those three things.
That's great. Hey, thank you, Chad. So, okay, Jenny, can you hear me? Let's see. It looks like you are unmuted. And let me click on. Yeah, so you are unmuted. It may be that your microphone is muted on your computer, perhaps. You can also call in. So here's what I'll do. Actually, I was pretty excited to do this because I was going back to when we first met Jenny. And what I love about Jenny is the fact that even before Amada, even before she found us, and she was referred to us by a very good friend of ours, a business broker, who's actually referred some phenomenal people to us, Vasilis. And Jenny was referred to us by Vasilis. And I remember when we first started talking, we love the fact that ever since Jenny's, you know, started her professional career, she's always been about doing good. She started with being an activities assistant and in a lot of home care facilities, got into fundraising as well for great causes, did fundraising for St. Mary of the Woods School and Parish in Chicago, a lot of different, raised tons of money for really amazing causes. And she is a geriatric care manager. And so even before Amada, she was always about doing good for people, for seniors and for her community. And so when we met her, it was almost, you know, we were pinching ourselves going, man, it's amazing that we get to work with Jenny Novy. You know, we were just so excited. Her husband is an attorney, great guy, and we are so lucky to have her on our team. And it was like she is trying to call in right now. So yeah, Jenny, so she switched from her computer over to her phone. Hey, this actually gives me another opportunity. Do me a favor. There's two ways that you can ask questions, because we are going to start off the call. We're going to ask Jenny questions. But this is a call for you. This is a time for you to ask any questions you have. So there's two ways you can do this. One is you can enter a question in the question box of the GoToWebinar panel. So if you expand the GoToWebinar panel, you can type in your question there. And in fact, you can type them in now. If you have a burning question you know you want to ask from Jenny, Chad is here as well, which is great. So Chad will also be able to answer any questions. But please type them in. Now, the best way for you to ask questions is just to raise your hand. So right there by your name, you can raise your hand. And when you do that, I'll be able to unmute you, and you'll be able to ask a question. What I like about that is you can ask a question live. You can do a follow-up question as well. So please make sure you feel comfortable typing in the question there or raising your hand so you can ask the question. And let's see here. Okay, so she's joining again. All right, hang on. Sorry, guys, some audio issues, but Jenny will be right back.
And maybe I can give you a little bit of a background, just so you guys know with Jenny. She came into the business, and she's actually been one of our quickest growing franchise partners. One thing is different states will require some type of licensure. So what normally has to happen is in your state, we have a licensure expert that we put you in touch with, and you work with that licensure expert to get your licensure submitted through the state. And the minute that Jenny got her licensure submitted, she hit the ground running. And she's done a really good job of building her clientele as well as building her caregiver pool. And she's been actually one of our fastest growing franchise partners for her time in the system. She's still relatively new, and so she's going through the startup phase of hiring new caregivers and finding new clients and building know-how within kind of, there's three major components of running a home care business, and that's being able to sell and go out and sell and market yourself to the referral sources that we kind of tell you that you should go be talking to on a regular basis. And she's really good and natural with that just because she's so client-focused. She does a really good job with her referral sources and relates to them very well. Jenny, are you there?
Yes, finally.
All right,
you made it.
You made it.
I'm watching all the slides saying, I don't hear anything, I don't hear anything.
Well, thank you. We just introduced you for the last 10 minutes. So
that's
the audience,
a big introduction.
That's a big introduction. So we went through your childhood, we went through your high school years. I mean, it was awesome. So these guys know everything about you, and so you get the benefit of not having to hear all of that.
Excellent. Good.
Now, hey, one thing I wanted to do to start us off, we got quite a few people on the call, and guys, remember, type in your questions or raise your hand. But I want to start off with you were introduced to us by a mutual friend. Can you kind of share what was going on when you thought about starting this business? What prompted that? And then just going through the process of going through that discovery process with us. Can you share that?
Absolutely. So when I first decided that I wanted to get back into long-term care, I had worked in long-term care for almost 20 years, and I took time off to raise my family. And so going back into long-term care, I could have gone back to be a consultant, going into nursing homes and assisted living. But I really wanted to be able to be my own boss and kind of control how the business would be run, how I could help people the best and make an impact in people's lives. So that really drove me to home care. And after taking care of my grandparents on both sides, I helped my family with that for many years. I really thought this was the best decision for me. And then I started to explore how to do that and what businesses were out there. So I looked at people who owned private businesses. I looked at different home care franchises. And really, when I was introduced to Amada, I told my husband right away, I said, this is what I want to do. These are the people I want to be with. They have the right mindset. They have the client and the caregiver's best interest, and they have an awesome business model. So that's
awesome.
And that was before I even met any of you wonderful people out there in California.
It was, right? Yeah, you and
it really
and you
was.
reached out.
Yeah.
Oh, go ahead.
I was going to say it really was. I mean, I just from reading about you guys and learning, and then just from Discovery Day, I knew that was really what I wanted to be doing.
So Jenny, this is Chad. How you doing?
How are you? I haven't seen you in forever.
I know. It's good to talk to you again. Hey, so maybe just talk to people and tell them a little bit about your time period. Like, how long have you been doing the business now, and what are the phases that you kind of go through? Before you got on, I was talking a little bit about how a lot of people have to go through licensure, and then maybe a little bit of the training process that you found. And now that you're out in the field, kind of working and selling and hiring caregivers, maybe tell them what your path has looked like, and maybe even dive in a little bit more to the exploratory Discovery Day process and how you made your decision, and then once you made your decision and came full-time to do this business on your own, what that looked like and what your path has been.
Okay. So for me, after coming out for Discovery Day, I knew I would have to go through licensure in Illinois. And there were no other Amadas in Illinois. So, Nina and I really kind of went hand in hand to go through the process. And she was very helpful. And it took me 9 months to get licensed. That was a long period. But in some respects, it really helped me gear up to start the business because it helped me put all my ducks in order before I opened my doors. So, my policy and procedure manual, how I was going to go about hiring caregivers, where my office was going to be, all of that needed to be done for licensure. So in some respects, although it was a very long process, I was grateful that once I opened my doors, I was ready to go. And I think that's really important because you don't want to start having the availability to take clients if you're really not ready to serve their needs. And I even was able to do an insurance call in November, and I was just waiting for my surveyor to come out, which was awesome because I got to do a long-term care policy and got my first client before my doors were open, which was great. So
wow.
That was thanks to you. And that was thanks to you guys. That came through the franchisor, which you guys are such a great host for making business happen. You really are.
Oh, thank you, Jenny. You know,
well, it's true though. I mean, without you, that I wouldn't be doing this. So it's very true. It's a wonderful company.
That's
but
nice.
then after I got my doors open, literally within 10 days of being open, I got a 24/7 client, and that was crazy. And just by happenstance, Rick was coming out for my marketing training that week. So I was so grateful to have him because instead of doing all the marketing we should have been doing, he was helping me hire caregivers and do the intake. And it was a long-term care insurance case. So he helped me turn the claim on, and it was a wonderful learning process, kind of with one case that I got to do so many aspects of what our job is. And
that's cool.
To have Rick here was very, very helpful. So that made a big difference. And I was able to, I had that client for many months, and that was a really wonderful way to start because it forced me to have day shifts and night shifts and scheduling issues, and on top of what the client wanted and needed and how to help that client, we had to adapt their house for a wheelchair ramp. We had to do all kinds of fun things that made it really exciting. That was exactly why, what I wanted to be doing, to be able to help people have a quality life in their house. And then also with the training, I would say with after Discovery Day, when you come out for training, you guys really hand all the tools off to us with all of the many days that we spend going over all the different aspects of the business. And for me, my strong suit wasn't, the operations, the billing and the payroll and a lot of the HR information. So that was a wonderful training session. And then you guys are a great resource because you can call anytime to ask questions. Something is, with a caregiver that you don't know how to write it up or how to do it, you guys have the answers for that. So it's very helpful.
Hey, Jenny, this is Chad. Talk to a little bit about, it can be a little difficult when you first start a new business. When you're used to just focusing on one job, all of a sudden you start your own business, and now you're a recruiter, a salesperson, a scheduler, a biller, payroll. Talk a little bit to the transition of starting your own business and maybe some of the difficulties of that, but how you kind of worked your way through, and now that's kind of, and then you start hiring and getting help to help with that. Tell us about kind of going the whole 360 view of having all this responsibility compared to maybe just having a job where you had one area of focus.
Yeah, that's absolutely true, because for me, I'm coming from the client side. I created programs for seniors. I was doing assessments. I was helping nursing homes have wonderful charting and MDSs and all of that. But on the business end of it, that was a huge learning curve for me. And I realized, being a sole operator, being by myself, I had to learn everything about the business before I could really bring someone else in, because I had to know what needed to be done. So I had to kind of focus on doing some marketing in the morning, and then all my client stuff and interviewing in the midday, and then I would save my evenings for billing and payroll and the time card manager. So I have to say, I've been working, I feel like it's a 12 to 15 hour day a lot of days, because you have to give time to all of those things. Because if I fell behind at one point, I was luckily, I had a couple of clients turning on at once. It was very hectic. So I kind of put the time card manager off, and then I wasn't generating my invoices right away. Well, you can't do that, because if you don't get paid, you don't have money for your payroll, right? So you have to have that all moving at the same pace for yourself. And a couple months into work, I hired just a part-time person, because, you don't know, it's a tenuous business. You could have 3 clients, but someone might pass away, or someone might graduate out of home care if it was a surgical help, or, it just depends. And so you don't have like that steady income, like, oh, I know I'll have income of $20,000 this month, so I can guarantee that. You can't, because things change all the time, and you have to keep growing your business. So you have to figure out what you're going to be best at, and then who you can hire to help you grow at the best rate. So my first person was someone in the office to help with the phones and to take information, and then I was able to train my assistant to also start doing recruiting, which was huge for me because that's so time consuming. So she started bringing people in, I do the interview, and then I trained her to do the orientation, and that's been great. Like, that's working out terrific. And now I'm at the point where I'm bringing on, for the first time in the middle of December, will be a full-time employee. So that's exciting, and she's going to help take over a lot of the scheduling and caregiver duties, and I'm going to spend more time marketing and growing the business and then client needs.
That's great. And I think that that's a common theme amongst all of Amada owners, is that as time goes on more and more, a lot of the people who tend to kind of resonate with us and that we resonate with are salespeople who really are caring. And our first value is compassion and charity. And Jenny definitely exudes that in everything she does. And I don't think if you don't have that, you're just not going to be successful in this business.
No, you shouldn't go into business.
Yeah, you shouldn't. It just won't work for you.
Yeah.
But I think once most of our people who kind of have that as their first value and they're salespeople at heart, they just like people. And so there's a tendency to kind of start hiring out the operations side of the business, which Jenny has done and which most of our people do. And do you feel like you're now kind of starting to gain your stride and kind of knowing from an operational standpoint, you've got your base set in the office? Do you feel like now you're kind of ready to expand to the next level, Jenny, on your business?
I am. I really do feel that way. I mean, 6 months ago, I would have said, I'm never going to get there, right? It's a juggernaut.
Yeah.
Like, you got to keep moving one foot in front of the other and not get discouraged, because it's a lot of hard work, and you think things are going to pan out, and they might not, and you think you're going to get a client. You had a great interview, and you don't get the job. You know, that happens. You know, that's life. That's business. And I think you have to, like, I was being too competitive almost with myself. Like, I should have every single person I meet should want to hire me, and, you know. And not that I'm not motivated, but I think I also relaxed a little bit. Like, I have to calm down. It's okay, you know. I didn't understand.
I went through the same thing, Jenny. I know exactly how you feel. I remember, especially when you're first starting your business and you're creating your brand and your market. In many cases, you're competing against 2 or 3 or 4 established home care companies. A referral source is trying you out, but you're competing heavily with other people, and you're really just establishing your brand, and it's a lot more competitive. Well, as your brand gets developed and people know who you are, you start getting referrals where you don't have as much competition attached, and they're only referring you and maybe one other person instead of 3 or 4 other people. So I think that goes to our other value, which is farmer entrepreneur mentality. And really learning that, your first 6 to 12 months, you're just planting seeds, and you're growing a farm, you're clearing the field, you're plowing the field, you're planting, you're watering, and the corn doesn't grow for a while. And it's a little psychologically disarming, and I think Jenny hit on that, and I felt the same way a little bit. But eventually the corn starts growing, and you're like, oh, this is, okay, now this is getting good. And I have people who are helping me to tend the field, and all I have to do is go cut down corn every day.
It's so true. Like today, I'm sitting in the parking lot because as soon as we're done, I have a potential new client intake that I'm going in to do at a referral source that I've literally been coming to for 9 months. And they never really have done anything with me, never really took time to talk to me. And finally, I got to see the social worker just by happenstance. She was in the hallway. Hey. And this is a nursing home that I used to consult at, and I couldn't get in, to even talk to anyone about my business. So it was very frustrating to me. And it's very close to my office, and, so I was always stopping in because it's so close. And so finally, now I've had 3 or 4 calls that she's passing out my brochure. She's telling people to use me when they're going home from their rehab center. So that's really exciting. Like that made me very happy to see, it's
Well,
our
awesome.
thing up.
Can you imagine, what a victory there's entrepreneurs who would have quit at the 6th or 7th or 8th month, right? Because they feel like it's not working. And that's, I think, I hear from Chad, I hear from you, I hear from so many of our top performers, is that not the only secret, but the biggest secret to this is not quitting, right? Is you don't stop. You just keep going.
Yep.
Well, and you don't know, like where I'm at, there's probably like 300 home care agencies. And one of the most giant hospital systems just started doing their own home care as well. So they have home health and home care, right? So that stinks. They're not going to be looking outside of that. But I have found that maybe they're not the best at home care because they're a hospital. So I keep going because I think they're going to need somebody at some point right away who can take care of a client that's in need right away. And I'm going to be the company that keeps coming. So that's what I feel like you can't give up on that. And I feel too, I haven't been as great at getting out for marketing like I would like to be. So finally, when this new hire comes on, I'm looking forward to marketing on a more regular basis. So I feel like, wow, I'm doing okay doing the marketing I am because I am, a sole operator. I'm doing everything. So it takes your time away from getting out of marketing. But look at, even if you're dropping it off once or twice a month as opposed to every week, or, it's working. It's the philosophy is working.
Yeah. And I think that's just there is a natural progression of, as you build your brand in the market, that sales just becomes a little bit easier every time. And I think even the hospital systems that are starting their own home care, in many cases, they're partnering with companies like Jenny out in that market who establish themselves as the go-to company. As the baby boomers age, the amount of clients is not the issue. It's like, we're really starting to see a major shift in the supply-demand curve. And there's a lot of clients out there. It's just a matter of branding yourself. And there's a lot of competition, but there's not a lot of competition that does things well. And if you can establish yourself as the resource, maybe speak to that a little bit, Jenny.
Well, I would say, too, because a lot of my first focus was rehab and SNF units and assisted living, because that's what I was most familiar with and felt like I had some contacts. But I'm finally getting to the point of reaching past that to financial planners. I just had a great meeting with a brokerage that they sell long-term care insurance. I met with the owner of the company, and after meeting me, he uses one guy all the time. And now he said meeting you and knowing your background and your interest in seniors, because he's the same way, he said he's going to start using us. So that's really exciting. And that was thanks to DR, because DR met him first and they do more business here. So that was really, that's another great thing about the franchisees, because we're trying to make everybody wants to be good, and we share our resources, and that's really
cool. Yeah, DR is our franchise partner there in Wisconsin. Great guy, and hey, by the way, hang on. Let me say this, guys. For those of you on the call, this is your chance to ask questions. You guys are very, very, very quiet. So if you have a question, no, this is great. But usually we have more questions. So guys, type it in or raise your hand. We'd love to hear from you. There's nothing taboo. If you'd like to ask, we'll allow you to ask here. And you can type in the question if you don't want to go on audio. That's okay as well. But hey, here's what looking at your background. Listen, you have your MS in gerontology, MA in therapeutic recreation, BA in communications. So you have like this clinical background, right? And you also did fundraising. So for somebody who's on the call, can you talk a little bit about what you think how your background helped you in this business? Instead of asking a 5-part question, I'm going to leave it there. How do you think your background has helped you in this business?
I know my confidence level when I walk in to meet someone is I know that I'll be able to help them make the right decisions of the future for their care, whether it be to go home or if they need to move to assisted living. I feel that that's been really beneficial. And also when talking to other people in the field, social workers and people in long-term care that are trying to help their clients find the best solution, I feel like if everyone would take a little time to know more about the seniors they're going to be facing, that it is a huge edge in your sales, because you need to know about some of these major diseases you're going to be looking at. Is this person going to be needing equipment for their house? Are they going to be needing 24-hour care, or a couple of hours in the morning is really going to be sufficient starting out? You know, so I just feel like in terms of coming from working with seniors my whole life, that's been a huge benefit for me. And I hope that other people take the time to get to know their clients that way, because it makes you a better business owner.
That's really what it's about in the end, right? Of all the operations, all the hiring, everything, it's really about that client.
Yes. Yep.
So, hey, I love that. Now, the other thing that I love that you mentioned is being a single operator. And I remember when we were going through the discovery process that your husband, Jim, was really super involved. He went through the franchise agreement with us. He was so cool to go to work through it. So talk about the support you got from Jim. And we always say to our franchise partners, if you don't have a spouse's support, if the spouse is going to work with you, great. But if you don't have their support, don't do it. Can you speak to that?
Well, sure. For me, that was a huge transition, because I did everything at home. I was running everything for school and for our family, and I have 4 kids. So for me to say, okay, everybody, I'm going back to work full time and more than full time because I'm going to run this business, was a big transition. And Jim, he's wonderful, and he's still wonderful about everything. He may like to want to know what my finances are a little more than I'd like him to ask about, but other than that,
that's the attorney in him.
How are you spending your money? I'm like, you don't need to know.
I can hear the cross-examination over dinner.
I have no idea. So, but it's very handy to have an attorney as a husband because of contracts. I've already, we had one employee try to file for unemployment, which they were not qualified to even, they didn't meet the minimum standards, but he was able to write up all that for me to submit. So that's been very handy, because being by myself, that's a lot of extra time on issues that you just don't have a lot of time for.
Yeah. I think that's so cool.
You have to have a spouse who wants you to try and do this, because this is, I'm getting called at 8:30 on a Saturday night. I've got to go. It's me. So I'm going to fill in when something's going wrong or a caregiver is having trouble. We have one client that's very difficult right now, and I feel like I'm on call all the time, like I'm waiting for the call again, because he's having seizures and they don't know why. So the doctor needs us to get him to a laying position, and it's normally happening like during mealtime while he's sitting at the dining room table, and you need 2 people to be there. So right now I'm the one going over to help. So I think that's some of the things as a business owner. Maybe people don't realize when you're starting out, you're doing everything. If someone can't make a shift, I'm showing up until someone can be there.
Right. Yeah. And, I think what I love about that, I think it's a huge gift, right? Chad always talks about the fact that when Top approached him and said, "Let's start this business," you went to your wife, and I think you were thinking she was going to shoot you down, right? Yeah. Or did you know what to expect?
Top had invited me to come start this business with him, and I went home, and I'd been working for a pharmaceutical company for 10 years. And I had a pretty stable job, and I came home, I'm like, you wouldn't believe it, but Top is crazy. He told me I should come, start this business with him, and I waited. And she looked at me, and she's like, yeah, you should. You should. Stop talking about it. You've been talking about doing your own business for a long time. Stop talking. Either do it or stop talking about it.
You were Ralphie going to Mom asking for the gun.
Yeah, no, I was waiting for her to shoot me down. And she basically said, "Yep, let's go. We're both all in." And at that point, we had 4 kids, and so we did it. But I think that's the spousal support is so important. You have to have that. If you're really thinking about doing an entrepreneurial venture, you have to have that. You can't succeed without it.
Yeah.
I love it. Okay, so guys, again, any questions that you have, please go ahead and type it in. Everybody's still here, which is cool. I really appreciate you guys being here for this. I hope this is helpful to you guys. And actually, there's a lot of names here recognized, guys. Thank you so much for being on here with us. So, Jenny, tell us this. It was 9 months of licensing, so you've been really operating for how many months then?
It'll be a year in January 15th.
Okay, so I try to go back and if you, and I know that sometimes people will call you one-on-one, right, to talk about the business, but
Sure.
What advice would you give somebody, almost like, you're thinking, man, this is the most important thing I should have done when I started the business, that I should have talked about, or I should have asked. What is the sage advice you'd give as a mentor to somebody looking at this business right now?
Make sure this is the population you want to be working with, that this is the field you want to be in, that it's not just monetarily driven because we have a lot of baby boomers, right? It's not about that. It's really about helping people. So I just think that's the key, that you go into this business for the right reasons, because there's a lot of businesses you could start to try and make money, that don't deal with people's lives, and you have to want to make a difference.
Yeah, and I'm going to say something to that. What I've seen is that the people who get in it for the right reason, and our number one value is compassion and charity, and number two is competitively driven to be the best. If you have those two driving core values, then you'll be successful in your business. But if you don't do this for compassion first, and because you're a competitive person that really likes to help people, and that you're adamant that you want to do that for your life, it may not be the best fit for you. If you're only looking at this just from a financial perspective, there's too much effort and sacrifice that goes in if you don't love what you're doing every day. And even though it's difficult sometimes, if you love what you're doing, it doesn't even feel like work. I've never felt like I had a job for the past 10 years.
Yeah, that's a wonderful way to look at it.
Okay, so last thing I wanted to ask you, Jenny, and guys, please, Jenny's got a client waiting outside the car, so we're gonna let her go here pretty soon. But if you have a question, what's that?
I'm kidding. She's sitting out in the cold. No.
I know, yeah. So hey, let me see if I'm sharing this. I want to just find out a little bit on the financial side. So probably one of the biggest things too is people, the question of, okay, what should I look out for? What should I think about? The other one is the financial side. So we always talk about this estimated, it's going to be anywhere between $87,000 to $174,000 to start your business, including the franchise fee. And not so much sharing your financials, but
no, I think that's the right estimate. I think that's right on.
Okay, cool. That's what I wanted to find out. So and would you say that this is to start your business, and you also have to have cash available to be able to run your household still, correct?
Yes. I mean, like I said, I was just very fortunate to have a couple of clients turn on right away. So I never really had to have a jump for payroll, or because I was having income. But that's unusual. I think you have to plan to have a couple of months where you're just building the business before that first client comes in. So you have to be able to have some cash flow to be able to pay your caregivers, to get your office supplies, that kind of stuff.
All right. And this is a shameless plug about our process, but a lot of the folks that we talk to, Tim Valencia is always talking about, the discovery days are coming up. Discovery days are coming up. But I wanted to find out from you, did you find value? I'm tripping over myself, but there are companies out there that do not require you to come out for a discovery day, right? If you want to, I don't know if you want to buy another business out there, they'll just of our 80-something franchisees.
It's really worth it to go for Discovery Day, to make sure that this is the kind of business you want to do. And you guys do a great job of kind of giving an overview without overburdening you with so much information at one time. And I think it was well worth it. And you have to want to work with you guys, right? Because you're a huge support system. We're out here. You're so far away, right? It was wonderful to meet everyone and to know what roles they play and how they're going to support you, and to meet some other people interested in the business that you guys are talking. I mean, I was so lucky to have Brady during my discovery day, and then we ended up being in training together, and it's been nice because he and I can talk now and again about things and how we're moving at the same pace. He was lucky he didn't have to go through licensure, so he got to open a lot quicker than I did. But
that's right. I feel like
you make lasting relationships that way too with the people that you go through the process with.
Yeah, we know that it is an investment of time and money, right? You're flying out, you're staying at a hotel, it's a whole entire day. You're exhausted by the time you get out of here.
It's a small investment to make such a leap in your life. I can't imagine making a decision without having gone through a discovery day with a franchise, in this business. You have to know what kind of company you're going to join.
So if any of you guys, I know Tim is always telling you guys, if you're on the line, hey, Discovery Day is this day, that's really why, right? We don't want to ever pressure you to come, but I always want you to have you aware. We have the Discovery Day coming up on December 7th and December 14th. Obviously, reach out to Tim to continue going through your discovery process, and he'll be able to usher you through this. Jenny, I can't thank you enough for doing this with us. Thank you so much for taking your time to share your experience.
Thank you for asking, because it's nice to be asked.
Jenny, thanks a lot. We hope you have a great rest of your day.
Guys.
We hope you had a good Thanksgiving and a good holiday coming up. We'll talk to you soon.
Thanks. Okay, guys. See you in February.
That's right. Thank you, Jenny.
Okay, talk to you guys soon. Bye-bye.
All right, bye-bye. Hey, everybody, thank you so much for joining us today. That was a great call. Thank you for taking the time. Again, reach out to Tim Valencia and keep going through your discovery process. He is always available. And, again, we have Discovery Day coming up on December 7th, December 14th. If that fits your schedule and if you're at the right spot, you obviously have to talk to Tim, make sure that you've gone through the required prerequisites to come out. But make sure they reach out to him. We'll walk you through the discovery process just like we did with Jenny. And we will be sending you out we have one more webinar for the end of the year. Chad and our second franchisee, Ken Jensen, are going to be sharing with you their experience. A little bit different. Ken was our second franchisee ever. So he'll be joining us for the last webinar of the month. So we'll be sending you guys an email so you can register for that. A couple of things going on there. But if we don't talk to you from now until then, we hope you have a wonderful Christmas, a wonderful holiday with family. You'll be able to take some time and be with the people you love. And again, it means a lot to us you take the time to listen to us and learn more about the Amada opportunity. We're super thankful for that. Thanks again. Have a great rest of your Wednesday. We'll talk to everybody soon. Bye-bye.